at the meeting. This includes commenting on specific agenda items only and addressing the full body. Public speakers will not engage in a conversation with the mayor or the chair, council members, board members, commissioners, or staff. All members of the public, Safety, Finance, and Strategic Support Committee, staff, and the public are expected to refrain from abusive language. Repeated failure to comply with the code of conduct, which will disturb, disrupt, or impede the orderly conduct of this meeting, may result in removal from the meeting. This meeting of the Public Safety, Finance, Strategic Support Committee, I'm just going to say PSIS from now on, will now come to order. Can the clerk, secretary, please call the roll?
Batra?
Yes.
Torres?
Here.
Kamei? Doan?
Present.
And Jimenez.
Present.
Thank you.
Okay, we're going to review the work plan. Sorry about that. I just got some of these notes before I got up here. Okay, so I'm going to ask for a motion to amend the meeting agenda to hear item D2 before item D1. Can I get a second?
Second.
Was there actually, no, can I get a motion and then a second? So
Okay.
you'll move, and is there any?
I'll motion. Second.
Sorry, I'm trying to read while I'm listening. All right, wonderful. It seems like we got a vote. And are we doing oral sort of voting, or is this thing working? Thank you for that. Okay, so we'll go ahead and vote on that motion.
Here we go.
Yes, so it's the green button that says yes. All right, wonderful. Very good. Okay, so we'll go to the consent calendar. Seeing nothing on the consent calendar. It is loud. I'm trying to figure out how to turn this down. These are not on, yeah.
No, we had two mics that were.
Okay. All right. So there's nothing on the consent calendar. We'll move on to item D, reports to the committee. And as we said, we're switching the Downtown Quality of Life Initiative first, right, Lee? So if we can have the folks come up, or anyone that's going to present on that, if you want to come up, please. Whenever you guys are ready, just go ahead.
Okay, thank you, Chair Jimenez. Good afternoon, Chair and committee members. I'm Blagis Zalalich, Deputy Director in the Office of Economic Development and Cultural Affairs. And I'm here today with my city colleagues to provide you with an update on some quality of life initiatives that we've been working on. I'm here with Rachel Roberts, Deputy Director in Planning, Building, Code Enforcement, Captain Carlos Acosta with the Police Department, and Kelly Hemphill with the Housing Department, Division Manager in the Housing Department. And so initially staff was directed by Council in March of 2022 to come back to this committee with an update around the Downtown Crisis Response Program that was launched about a year ago. Today, we're actually bringing forward a more comprehensive report on our...
Sorry to interrupt one second. So I'm not sure we're able to view what's on the screen in this little monitor, are we? Because so you need to still click on the larger screen. No? Is it here? Okay, because I'm on... Sorry about that, Bloggy. Oh, there it is. So hit 1 from that home screen. There you go. All right. Sorry about that. Take it away.
Are you good? Can
I think we're
everybody
good.
see it? Okay, we're good. Gotta love technology, right? Okay, so today we are actually bringing forward a more comprehensive report on our work around downtown quality of life initiatives. And we'll discuss efforts in the following categories: crime reduction, blight mitigation, social service coordination, and quality of life metrics. Okay, and so I am actually going to hand it over to Captain Acosta to talk about the first one, which is crime reduction.
Thank you, Blage. Good afternoon, committee chairperson, committee members, and members of the public. As mentioned, my name is Carlos Acosta. I'm the Central Division Captain with the San Jose Police Department that oversees the downtown core area. The San Jose Police Department understands the importance of having a safe and vibrant downtown. I will be covering the crime reduction portion of the status report. The department's current safety plan is to supplement our standard patrol division with additional services consistent of the Downtown Foot Patrol, Downtown Services Unit, and the Community Policing Officer. The Downtown Foot Patrol model features a three-prong approach: personal interaction with community members and businesses in the downtown area, participation in criminal investigation leading to arrest and citations of criminal offenders, providing a consistent and visible presence to help reduce crime. The Downtown Services Unit is a plainclothes unit, and its goal is to provide a presence in the downtown area to discourage criminal activity. Additional duties include narcotic enforcement, handling quality of life issues, graffiti enforcement, curfew management, and traffic diversion. Community policing activities are prioritized during any free patrol time. Additionally, one community policing officer is a collateral assignment from a patrol and is assigned to the entire Central Division, specifically in the downtown area. The officer regularly attends community engagement events and crime prevention presentations. The graph you are viewing now provides a comparison of arrests and citations from the Downtown Foot Patrol, Downtown Services Unit, and district officers from the previous 6 months, broken down into two time periods. The first is January 24th, 2022 through July 24th, 2022, during part-time deployment of the Downtown Foot Patrol. And the second is July 25th, 2022 through January 25th, 2023, and that's during the full-time deployment of the Downtown Foot Patrols. The total number of arrests and citations events increased 15% during the later portion of July 25th, 2022 through January 25th, 2023, with a total of 911 events, compared to January 24th, 2022 through July 24th, 2022, with a total of 794. Overall, during the last period, July 25th, 2022 through January 25th, 2023, criminal citations increased by 28% and arrests by 19%. This increased activity may be due in part to the increase in service level enabled by the full-time Foot Patrol deployment, as well as an increased engagement with businesses that the full-time deployment makes possible. Thank you. I'll now turn it over to Rachel Roberts in Co-Enforcement.
Thank you, Captain. Let's see. Okay, so I'll be speaking on the first topic there under the Blight Mitigation Strategies, which is our neglected vacant building and storefronts program. So to provide some background, the Vacant Building and Storefronts program is a fee-based citywide program intended to ensure that vacant buildings and storefronts are secure, free from blight, and are maintained in accordance with the municipal code. And as you may recall, in 2017, the council approved an ordinance amendment to include vacant storefronts within this program and to add a downtown mandatory registration area to provide an added level of focus and monitoring as well as enforcement in the downtown area. So the majority of our program is complaint-based. However, we do conduct proactive monitoring inspections for building or storefronts that have been in violation for 30 days or more, or if they are located within the downtown mandatory registration area. In the instance of a building or storefront that is determined to be in violation for 30 days or more, we are conducting a monthly inspection and that is done proactively. If they're not in violation but are within the downtown mandatory registration area, we're inspecting those buildings or storefronts quarterly, and that's also done proactively. So currently within the downtown area, there are 64 vacant properties, 6 of which are being monitored on a monthly basis and 4 are being monitored quarterly. The remaining 54 identified properties have not been enrolled in the program, in that there is an exemption in our ordinance that if they meet certain criteria, they are not required to be enrolled in the program. So that criteria typically includes, or does include, that if the property is actively for sale or lease, if they have an active building permit on file, which they're actively working towards completing, or if they've maintained their property free of any violations for 6 months or more.
And so, for a while now with respect to blight mitigation is the storefronts activation grants. And that's really about getting the word out to our businesses, both downtown and citywide, because it is a citywide program, on the fact that we do have both a vacant storefronts and an exterior storefronts grant program. The program actually has transitioned over the last year. It used to be a reimbursement basis program, and now we are giving those grants proactively as long as the business meets the criteria for the program, which is that they need to have at least a 3-year lease or an extension that shows 3 years, and that they continue to operate their business from at least 3 years of when they receive the funds. So over the last year, we had about 30% of the grants that were given out in the program were given out to downtown businesses. There were 3 vacant storefront grants, and that's a $15,000 grant, and there were 10 exterior storefront grants. And the exterior storefront grants is for things like outdoor seating, for getting a new sign, for painting your facade, anything that has to do with improving the exterior of your building. Obviously, the vacant storefront is for the inside, so anything that has to do with permits or anything kind of operationally that you need to install to start up your business could be covered in a vacant storefront grant. The third strategy that downtown has, kind of very different than anywhere else in the city, is really the downtown property-based improvement district. And that is a special assessment district. Just this past June, the property owners downtown renewed the district for another 10 years with almost a 90% approval rate. And the PBID services that are delivered through Groundworks, the folks that you see downtown wearing the orange and green shirts, are specifically centered around enhanced cleaning, safety, and beautification services. With the renewal of the PBID for another 10 years, there was actually an expansion component to the boundaries of the PBID, so going more into downtown west, going into the North San Pedro area, kind of just above San Pedro Square, between San Pedro and kind of the Market Center Coleman, and then also into along East Santa Clara Street. The PBID is managed through the San Jose Downtown Association, and obviously the city has a very long history of programs and partnerships with the Downtown Association. The city is also a very significant contributor to the PBID in the sense that the city pays assessment on the property that we own in the district, and the city also contributes to the district with a baseline level of service that was taken over by the PBID when the district was formed. One of the other components that came out of our meeting with downtown stakeholders in the summer of 2022 was actually a desire for us to engage in increased social service coordination. And so a small group of staff that includes city staff, county staff, the Downtown Association, and PATH actually began meeting on a more regular basis to try and work towards the 3 desired outcomes that you see in the first Downtown Social Service Coordination Working Group bullet up here on the screen. And those outcomes were establishing a coordinated plan for downtown's most vulnerable, establishing a ground floor case management storefront, and also vetting the feasibility of creating one phone number that downtown stakeholders could call for non-emergency quality of life related incidents, which is actually a much more difficult task than one might think. So at this point, the group is primarily focused on achieving goal number 2 or outcome number 2, which is the establishment of a case management storefront, someplace in the core where either PATH, who's our downtown service provider, and or the new social impact team that the Downtown Association is standing up through the PBID, will be able to invite folks that they are working with and trying to connect to services into a warm space, you know, out of the cold, out of the elements, and kind of get them engaged in like the paperwork and start the process that they might need for more wraparound case services management. And you'll hear more about the care team from Kelly in a moment, which might be right now.
Thanks, Blage. Kelly Hemphill, I'm the division manager overseeing homeless solutions in the housing department. So the city partners with PATH to operate the Community Assessment Rapid Engagement Program, also known as CARE, and also known as the Downtown Crisis Response Outreach Program. This was implemented in July of 2022, so we do have pretty significant data from the first 6 months of operation, and this includes PATH receiving 94 calls requesting rapid outreach support in the first 6 months, and 22% of those calls involved an individual in active distress. So PATH was able to contact about half of those individuals within a couple hours to address their needs. The other 10 or so could not be found. So that's kind of the importance of this program, is being able to respond rapidly to residents who are calling in. People who need care can call in. Probably 68% of the calls, 68 calls occurred during normal business hours, and then there was a few that occurred after hours. And most of the calls were from concerned residents. So that's just kind of a snapshot of the CARE program. PATH is here today, so they can answer some detailed questions about the contract if necessary. But I will stop there and hand it off to the next speaker.
And so lastly, another thing that came out of our stakeholder conversations that were held last summer was the desire really to establish a set of downtown quality of life metrics. And so as a result, we started with Q4 of 2022 to establish some baseline metrics in kind of the 4 core areas that we were focusing on, which is vibrancy, crime reduction, blight mitigation, and social service coordination. So trying to kind of keep the same focus throughout this conversation. And really the idea of these baseline metrics are to be able to inform either program, policy, or initiative changes and adjustments that either the city will want to make or our program partners will want to make. And so with that actually brings us to the conclusion of our presentation, and we're obviously all here to answer any questions the committee might have. Thanks.
Thank you, and I suspect you will have questions. So we're going to go to the public first. Do we have anyone online or present that has any public comment?
Blair Beekman?
Hi, Blair. Hi, Blair Beekman here. I'm done. Yeah, hi. Blair Beekman here. Sorry about that. I was on another line actually. Yeah, about this item, the future of safe city, good design for the downtown area, quality of life for downtown area. Quality of life, what I'm understanding is as quality of life things are concepts that are around the future of the open democratic community process. That's how we talk about quality of life. And then I think that UN objectives originally started as quality of life issues. Obviously, we've had a difficult time doing that, and we've been engaging in the concepts of war before peace. And if we make commitments to ideas of peace through the concepts of open democracy, that's how you build the quality of life issues. And that goes to Vision Zero. You know, what are we doing to build quality of life, community harmony? I mean, these are suggestions, you're offering things. To offer the work that I do with accountability with tech is incredibly important. Think of people in downtown can feel comfortable to ask yourselves what sort of technology is being placed in downtown that's surveilling me. Can I ask you those questions? If you can answer those questions, that's building quality of life. That's building trust. That's building community democracy. Good luck in those efforts, and it's important we work on these things, and thanks for this item.
Paul Soto? Paul?
Yes, can you hear me?
Yes, sorry, the timer's actually not working, so 2 minutes starts now.
Okay, can you give me a 10-second?
I will.
Thank you.
Thank you.
What I'd like to talk about is PBID and SB 43. Now, what PBID is tasked to do is to go through downtown with social workers. And those social workers are going to leverage, if passed, SB 43. What this does is it waters down and dilutes the basis by which you can place somebody involuntarily inside of an institution. The problem with that is that it's doing it under the premise of being kind, of being compassionate, and really concerned about the safety of the person. The time to be concerned about the safety and the quality of life for the person was with his parents or with his grandparents, because these issues that we have as a city are generational, and we have never come to a time where we have removed the major contributor to crime, which is poverty. Reduce poverty, you reduce the crime. It's a very clear correlation, very clear. There's no debate on that. So what is concerning is that the legitimization of having this presence downtown and then locking people up because they're experiencing the neglect of the city policy to address the racist policies that have infected this city for generations. So we need to, why don't we talk about that? Because there has never come a time that you can introduce me to a day where that has been properly contextualized, analyzed, and then institutionalized. Policies that address those issues, which in turn would have a direct impact on those crime metrics. That's what I'd like the discussion to be around. Thank you.
Back to the committee.
Thank you. I think first on my list is, I saw Councilmember Torres has some questions. Go ahead.
Great. Good afternoon. Thank you, Mr. Chair. And most importantly, thank you to Blage and those who are part of the working group. I see PATH and San Jose Downtown Association. I'm pointing at the wrong people. But most importantly, I actually want to thank our small businesses in our downtown who continue to be resilient, and continue to succeed with so many concerns in our downtown. And we see them and hear them every day, right? Unhoused residents, retail crime, vacant buildings, and other blight. And those are our true champions in our downtown. And we really, really have to do this right. And so, as a downtown council member, I really want to work with our city departments, our nonprofit folks, and our small businesses to create effective policies and solutions for our downtown. And so I remain optimistic and committed, but I know that we have major concerns. And we see this in the report. 9 openings of our businesses, yet 6 of them closed. Right? Countless of graffiti being reported, but our city doing a good job, and groundworks as well, painting over that graffiti. Downtown foot patrol. It could be a little bit better. We can do downtown foot patrols later on in the evening when it's a little bit more necessary than the daytime. So I have a few questions, and one of the questions is, and I think I heard the captain. Thank you, Captain, for being here, and thank you for all that you do for our downtown. Our downtown services unit is plainclothes.
Yes,
Okay. And our downtown foot patrol is uniformed.
yes,
Our downtown foot patrol is 9 to 5.
that's correct.
And then our downtown services unit is what time to what time?
Their hours vary typically from 10 a.m. to 8 p.m.
Okay. Has there ever been any talk of doing downtown foot patrols during either the swing shift of our SJPD or from 2 p.m. to 10 p.m. when especially Thursdays, Fridays, and Saturdays when our small businesses need them the most? I know it's important to have them from 9 to 5, but it's also, we also want to make sure and provide coverage to our small businesses in the evening, because unfortunately, for those of us who have dealt with friends and family who are addicted to substances, at that time, a lot of folks are coming down, right? And so it picks up again in the evening. And I'm not saying that our downtown foot patrol is just patrolling for mental health issues. It's one of them. But also, we're getting a lot of small businesses being broken into in the evening, especially in some of our not so productive or thriving corridors, or being broken into during the daytime as well, or after the cops leave. So has there been any conversation regarding doing downtown foot patrols in the evening?
Thank you, council member, for the question. So initially, when we started the full-time deployment, at that time, we also had additional police services that helped us in the downtown core area, downtown services unit being one of them, and our Easy Car deployment and our MCAT and other departments and officers. So based on the need then, when we started the full-time, which was July of 22, there was a lot of need for the day shift, right? We were coming out of a pandemic. We had a feedback from community members, businesses, visitors, parks, et cetera, where some of the things that they wanted us to address were blight issues, unhoused, vagrancy issues, and sometimes a lot of illegal activities at our local parks, meaning St. James, Arena Greens, Cesar Chavez Park, et cetera. So at the time, we decided to go with the deployment of 9 to 5. But there has been some discussion, but nothing definitive to this point.
All right, I definitely want to continue the conversation. I know we have a very long PISFIS meeting, so I only have 2 more questions. I'm going to have my team send the questions that I did have. Unfortunately, we didn't get to have a briefing this week about this item. I want to go to blight, which is a major issue in our downtown. And this is for Rachel, I believe. Hi, Rachel. Has neglected vacant buildings, storefronts, has the neglected vacant building program been functional? And what is the process if there is an absentee landlord that is not paying the fees?
Okay, so the first part, we're functioning as best as we can. We only have 1 inspector assigned to that program. That's all the funding we have and positions we have dedicated to that program. So, vacant buildings, the number that we see not only in the downtown but throughout the community does change with the times based on what's happening. So we have seen, as you know, an uptick in the number of buildings throughout the city. So we definitely could use some additional staffing to support that program so that we could be even more responsive. But we are doing our best to get out there, make sure we're hitting our targets for the quarterly monitoring that's required. That's the proactive piece that's we're checking these buildings to make sure they are maintained in accordance with the code, and then if not, then they move into the monthly monitoring. So, so we are, as I said, doing our best to meet those targets, and we are most of the time. And then, but there's a lot of enforcement that goes into maintaining these vacant buildings, because on any given day, you could have someone that trespasses the building, breaks in,
Right.
it becomes unsecure. Now we have to do a board up, or they have graffiti or some other blight, and that we have to address. So they're all at different stages of enforcement. It just depends on what's happening with the building. As far as
Wait, give me a second.
Sure.
Just to clarify, sorry to interrupt. Just
No
to
problem.
clarify, we have one inspector for the whole city of San Jose for vacant buildings?
that's correct. Yeah.
One inspector for a 1 million person city. Okay,
Yep.
got that.
Yes. And then as far as if the property owner is not paying the registration, they're billed quarterly, so they would be, they're billed 3 quarters at a time. And so if they don't pay that registration fee, there is a process in the municipal code for us to bring them before the appeals hearing board for not paying that registration. But as far as if they're not maintaining their building, like there's blight, it's unsecured, and so forth. We use our normal enforcement processes for those situations, so citations and administrative remedies, abatements, that they're held accountable for the costs and so forth.
Great. I saw that the fine is $217 per vacant building?
So that's actually the registration fee for the downtown mandatory area. So that's a building that's not in violation, but they happen to be vacant and within the registration area. They're required to pay $217, which is the cost of that one inspection per quarter.
Okay. And then lastly, I want to definitely talk about our unhoused in our downtown. One, I definitely want to be part, my office or myself definitely want to be part of the working group that we have. So, you know, I'm very committed to a cleaner, safer downtown for everyone. And then the second question is we recently had a constituent who was unhoused who called us during an abatement. And when my team got there was no services for him, unfortunately. And so, you know, we've been told time and time again that services or folks who cover that area must be there. But, you know, this man unfortunately had no help, no assistance, while our SJPD and Beautify SJ were abating that, but he, you know, unfortunately was left with his hands up in the air, and already so much is happening to this poor man's life. But there was no one there to help him. So I really just want to make sure that when we are abating these encampments, that we actually do have services there. Because we're told time and time again that they're not. That they are. That they are. But in that situation, they're not. And this unhoused resident actually called our office, and my team had to go out and check it out.
Thank you for the question. We actually do like to separate outreach from abatement activities, and outreach goes out to the encampment at least, or the goal is at least 2 weeks prior to the abatement to alert the people who are living there of the abatement. We like to separate it because outreach plays the good cop, whereas the abatement crew is more of the bad cop, and interchanging them can get confusing. We are in the middle of revamping our policies and procedures as we move through Beautify SJ and housing working together on these efforts. And we can certainly discuss what that would look like. And it's hard because we only have 5 people on our citywide outreach team who responds to abatements, and we get over 6,000 calls a year.
Yep.
So it's a very reactive team. We're definitely strapped for resources to be at every abatement.
Right. Yeah. And I know how hard it is to work with our unhoused population. And I know that our team is doing their best. But again, when my team went out there, you just hit it right on the head. When my team went out there, they were like, well, who can we talk to? One person said, that person. And then when they went to go speak to that person, oh, that person. Guess what? That person said, oh, back to the first person. And when city council staff goes out and is doing that in front of our unhoused resident who is already suffering the worst of the worst, that doesn't look right. Not only on us, but I mean, they're losing faith in the system as well. So I'll just leave it at that. I have tons of more questions because I didn't unfortunately get a briefing this time around. So I will send my questions to either Blage or folks. So thank you.
Thank you, Councilmember Torres. We're going to go to Councilmember Batra, please.
Okay. Good afternoon. Thank you for that report. I got a couple of questions because I think my colleague covered a lot about the downtown the crime area and unhoused. So I'll ask you a couple of different questions. One about your vacant stores. You reported what has been filled and what you have brought. Could you give us an idea of where you are in any backlog of inventory of people who you are talking to, and over the next 3 months to 6 months, how much of it you may be able to fill? Is there any such data available to you?
Councilmember, just to clarify the question, are you talking about the grants that were given out for a vacant storefront improvement, or are you talking about just vacant storefronts and kind of leasing activity?
Both. Whatever you can break down, whatever you can provide on that one, because obvious goal is to see that those storefronts are actually occupied and they're thriving. So grants is only a way to get them there. So I'd like to know as much as is available.
Sure. So with respect to the grants, I would say that at this point, we have been able to service the needs and provide the grant for all of the folks that have approached us, whether that's downtown or citywide, for the program. We do anticipate that we will use all of our funding up this fiscal year, and we're looking forward to hopefully getting funding next fiscal year for a program that can serve both citywide and the downtown constituents. There was some talk in the Mayor's Transition Committee about a specific allocation to activate storefronts downtown, and so we are putting that in. Well, the staff is putting that into the list of items that the administration, we're asking the administration to consider in this next budget process. With respect to leasing, so the numbers that we put up were literally just for Q4. So in Q4, that we had 9 storefronts, or 9 new businesses open. We did have 6 businesses closed. I don't know that those were, how long those businesses were in business or for what reason they went out of business during that quarter. But we do work very closely with the Downtown Association, and we work very closely with the commercial brokerage industry and the couple of folks that work downtown on a regular basis, and try to do whatever we can to pair small business owners that come to us with obviously absorbing the vacant storefronts that we have downtown. So part of the reason that we wanted to start to collect these metrics is to have a better idea, kind of quarter over quarter, what our gain and loss might be. And so I think we'll be able to tell that now more moving forward. But we definitely have, over the pandemic in the last couple of years, we have certainly had people look to open their businesses in downtown.
Thank you. On that 9 open and 6 closed, they're not the same, okay? Hopefully they're different for a different reason. Okay. I had a question on, there was a comment made that Path received certain number of calls and they could only not locate certain number of people when they went. Have we given some cheap cell phones to these people with their location indicator so that we can really try to find them, just like the 911 services. They are able to find where the call came from. So without invading into their privacy, if we are able to get such a tool in place for their safety and be able to locate them more efficiently, we should look into it, unless you have already looked into it and found it to be not practical.
Have not looked into that.
Okay. Yeah, so if you haven't looked into it, please look into it. You may or may not be able to do it. There might be other privacy concerns and other things might come in your way, but if not, it would be a good thing to have in place so that we can locate these people and give them the service they need. Okay. Thank you very much. Okay.
Okay, next in line is Vice Mayor Kamei.
Thank you. Thank you for the report. I know that downtown has many sort of layered issues, and I'm just wondering that overall, I'm really delighted that you are going to be tracking and having metrics so that, you know, the data will inform all of us. But I'm just wondering, given that downtown really needs a lot of love in many aspects, is there a strategic plan in terms of how to deal with all of these complex issues? Because as you layer them, it's going to take a long time. I mean, you know, it took time to get to where it is. So it's going to take a long time to be able to assist and help those who need the help, as well as bringing storefronts to be much more, as Councilmember Torres says, vibrant, right? I know a lot of people who don't want to come downtown simply because they feel that, well, what's over there? There's nothing over there. And while I don't think that's true, I also think that we ought to have some kind of strategy to be able to say, okay, we're going to deal with this here, we're going to deal with that there, and this is how we're going to move over. Some things are going to take longer than others. And I was just curious as to whether, and maybe you have that already, but I think that as we move forward out of where we've been the last 3 years, we ought to be very strategic in how we move forward. And I do know that the Downtown Vibrancy Group had recommendations. I know that the mayor wants to put money in for some of the need there. But I also think that we need to be intentional, because we can continue doing the same thing and have the same results. So I'm just wondering, is there going to be something that's much more, you know, sort of planned?
So, Council Member, I appreciate your comments, and I would say that I think that we are being intentional based on the overwhelming feedback that we have heard as we were coming out of the pandemic, right? It was a little bit different kind of pre-pandemic in 2019, and kind of where downtown was and the trajectory of downtown and the investments that had been made, and just kind of the general talk about downtown was much more upbeat. And then COVID happened, obviously, you know, has impacted our city. Throughout the city has had negative impacts, but specifically downtown has been much slower to recover for a variety of reasons. And so I would say that in our conversations about how to get people to come back downtown and why, let's say, somebody would rather go into their office versus working remotely from home, it really has centered around ensuring that the environment that they're coming into, or their environment that they're going out to lunch to once they've come into the office to work, is inviting. It's clean. They feel safe. They don't feel you know, kind of scared or uncomfortable in any way. And so we heard that from a number of stakeholder meetings that we've had. We've heard that from the transition committee coming together. We've heard that from, you know, our partner organizations like the Downtown Association having their town hall. Kind of those themes have been iterated over and over again. And so that's really where this kind of quality of life initiative is focused and centered. And I would say that even in our conversations with the developers that are either have their entitlements downtown and or have their shovels in the ground currently, as well as with the brokers that are trying to fill the vacant storefronts, those three or two themes of clean and safe come up repeatedly, as well as, and I would include kind of as well as the homeless situation or the unhoused situation. So I think for right now, we're kind of all working towards the same two or three, we have these two or three umbrellas, and the strategies and the tactics that we're implementing seem to be pretty aligned with what we're hearing from a variety of different stakeholder groups.
Yeah, I think maybe within a certain circle, you know what you're doing, but I think more broadly throughout San Jose, I don't think that's the case. I think that people come and, maybe they go to the library or something and they find themselves, oh, well, nothing has changed, right? So I think that more broadly, perhaps we need to tell others what they're doing, what you're doing.
Okay, we have Councilmember Duan.
Thank you. Thank you, Blage, Rachel, and Captain Costa for being here. I just got a quick question. Do you have a metric to measure the success from PATH, especially from the end user point of view?
A metric to measure what?
The success, how PATH have successfully helped our unhoused residents.
Oh, PATH, okay.
Yeah, PATH.
That's Kelly's department.
Oh, sorry.
I might ask PATH to come down and talk to that. Is that okay?
Hello.
Hello.
Thank you for your question. So we do have some contractual outcomes according to our contract. Primarily our goals are around connecting to people, getting them permanent housing placements, transitional or interim housing placements, and also completing assessments to get people enrolled in our county's coordinated entry assessment system. Those housing assessments help determine if somebody is best placed for permanent supportive housing, rapid rehousing, or other types of housing interventions.
So about 3 weeks ago, we had a conversation with Renaissance, and they said they had 20 units available. And here we are, we have a lot of unhoused residents, and somehow we have 20 units that is available and is not being used. Are you connected to the Renaissance and other avenue to get our unhoused residents into those places?
Yes, we are. So we operate within the Santa Clara County's coordinated assessment system or coordinated entry system. So that housing assessment that I mentioned before helps triage people to the right level of care. So people who are the most vulnerable, folks who have the longest history of homelessness, folks that have the most medical vulnerabilities, mental health vulnerabilities, history of violence within their families, they're prioritized to the top of the housing list for permanent supportive housing placements. So whenever a space becomes available in any kind of supportive housing community, whether it's Renaissance or Villas on the Park or other types of supportive housing, the most vulnerable people get referred and matched to those programs. And our outreach teams do those assessments with folks.
And how deep is those assessments? Is it from a psychologist point of view, from a social worker point of view, or just there's a simple spreadsheet?
So the assessment is actually a standardized assessment that was developed about 10 years ago at this point. Every county delivers these assessments, and every outreach worker and every entry point in the system is trained to be able to deliver this assessment. Whether you're a social worker, whether you're an outreach case manager, a peer support specialist, anyone should be able to deliver this assessment.
And if you were to rate yourself in percentage of success out of 100 unhoused residents that you serve, what the percentage of successful of placing those unhoused residents into some type of service or temporary housing or interim housing?
So our contractual goals, I'd want to double check and get them back, but I do believe that our contractual goals say roughly 15% of folks getting placed into permanent housing placements. We know that that sounds low, but we also work with folks that may be earning $200 a month. So a large portion of our time may be helping people to increase their income so that they can afford rent when they leave our services. With the expansion of our outreach team through this CARE program, we were able to add housing specialists who build relationships with landlords so that we can increase our available housing stock even outside of the coordinated assessment system. It helped us to be able to create a benefit specialist position, knowing that some of our folks, their primary attention needs to be towards treating their health care and getting medical assurance and getting benefits for that. So we have benefit specialists that will help people be able to increase their resources in health care so that they can focus on that full time. Yes, our goal contractually, I believe, is 15%. In the last 2 quarters, I do believe I have my goals here. In the past 2 quarters, I believe that we've seen about 11 people exit our services due to permanent housing placements, and then an additional 27 people get connected to temporary shelter where we can continue to work with them.
A lot of these unhoused residents doesn't have any ID on them. How do you help them in order to get ID, to increase or zero income to some type of income, and in order to get them off their feet and into some type of supportive housing?
That's a great question. That's actually one of our primary goals that our outreach team is working on with folks, even while we're still waiting to find housing placements for folks. So anybody, when they enroll in our programs, we do an assessment to screen what types of benefits and income people already have. We try to pair them with benefit advocacy and application support. We also recently created an employment specialist for people who are interested in working to be able to increase their earned income as well. So every single person who comes through our program and gets paired to ongoing case management gets that ongoing type of assessment and support.
Does your program have any type of job training prior to get to?
The employment services that I mentioned, we've actually been able to host a number of job fairs in the past couple of months that have been really successful and have actually created direct application opportunities with employers.
Well, thank you very much for your hard work. That's all I have.
Thank you so much.
Thank you all. I'll just ask a few questions, and then I think we have a motion. One of the things that came to mind as Councilmember Duan was asking questions, I think that in the mayor's March budget message, there was a mention of a dashboard. I know that, Alex, you've mentioned what they were doing in Reno from the Downtown Association, where there's going to be a dashboard, if it passes, in which it'll reflect in very real time, it seems, how many beds are available and where. And so that seems to me to be a critical thing, that sort of what you're touching on, right? How do we plug people into those? So just wanted to share that so you can keep an eye out for it.
Yeah, thank you.
Yeah. I just have a few questions about, obviously, downtown. I was hoping someone just to sort of provide a sample of what you're dealing with. I noticed on the corner, for example, and this is obviously not a representative of downtown, but I'm very familiar with downtown, corner of 2nd and East Santa Clara Street, you see that that corner there that sort of has the board on front. I think it's called Eyes or something, some artwork that's up there.
The U building.
What is it called?
The U building.
The U building. So can you share with me, because it seems it's been vacant for a while, what the situation is there as an example to help us understand how we approach it? I think that would be informative. Ms. Klein, they brought out the big guns, huh?
Oh, code, most definitely, go ahead. Okay, so my obviously I'm going to share the code perspective.
Please.
So that building has been vacant for a very long time, and we've been doing ongoing enforcement. It's been in the monitoring program. We did issue a compliance order under some provisions within the vacant building ordinance that speak to chronic vacancy, and they are now have a building permit, so they are considered somewhat exempt. But there's some other issues still going on related to that building, and so they're not out of our program yet. But the former Mayor Liccardo brought forward a proposal just before the end of his term that we take a look at the ordinance and see if we can strengthen the ordinance based on that exact scenario where we're seeing buildings that just go on and sit vacant with no activity or intent of that changing. So at some point, staff will be looking at that.
Okay, Nancy, I don't know if you want to, since you're up here.
Nancy Klein, Economic Development. Just wanted to give you a minute of the background. The U building we've been working with for a very long time. There was a redevelopment agency loan that now is very clear that the building owner has defaulted on. We are putting them, Julia Cooper Finance is putting them in foreclosure. And part of the other piece that's difficult, council member, is the hazmat, which they were tasked to clean up and got a grant from DTSC, and they're also in default.
Was it a dry cleaner there?
Yes,
Is that why? Okay.
in the basement. Is the cost to clean up the hazmat, because after time being left without being cleaned up, is in the groundwater, and it has migrated beyond the site, and cleanup of the hazmat is greater than the value of the building. So we are working to find a way for another entity to get hold of the building. So those steps are in motion, and we know it's unsightly and it's taken way too long.
Okay, that helps me provide some context. I suspect many of us walk by these buildings and wonder what the hell's going on, right? So. Yeah. This helps. Rachel?
I'll just add that part of why it has the eyes, the plywood and the eyes on the building is we were having a person repeatedly breaking into that building, and so we asked they secure all openings on the ground level, and then Buggy's, I think, team or PBID was it?
SJDA?
Yeah, worked to get the artwork up, so at least you're not looking at plywood.
Yeah, I sense it was there to help try to beautify it while it's vacant. So I guess, Nancy, or actually you, Rachel, touched on something. One of the many gifts that Mayor Liccardo left us before he left, it seems to, was it something of rules that he submitted as relates to the Muni Code? Can you remind me?
Yes, it was submitted rules.
Okay. Because one of the things I was curious about is, we're essentially as a city up here, we're the policymakers setting the rules by which it seems that these building owners need to abide by. And so I've often wondered, well, why don't we strengthen those or change them or do something to help enforce it? And so where exactly is that? So that, I'll call it a referral, but that recommendation was made to rules. Did it pass? Where is it? To anyone, I don't know, Lee.
Lee, do you want to talk about that? I mean, it's been direction given. We haven't incorporated it into our work plan and set a timeline for it yet. But.
Yeah. Rosalind, I don't know. Amongst maybe all the other stuff all the other stuff planning's doing, I suspect it's probably.
Thank you, Chairman. It's Rosalind Huey, Deputy City Manager. So yes, to follow on what Rachel was sharing. So that memo on downtown, there were actually a couple of work plan items was approved. And staff did share that we would be incorporating those items into our work plan. What we will do is go back to that and see what items that we're ready to report on. Likely, we can certainly issue an info memo or decide how best to inform the City Council of our progress.
Thank you. And then, Rachel, you had mentioned earlier to a question from Councilmember Torres about there being 2 inspectors. Is it for downtown or for the city?
One.
Help me, yeah.
Whole city.
Remind me what you said, the number you given.
We have one FTE, one inspector funded for the vacant building program citywide.
Okay.
That
all
includes the downtown mandatory registration.
And so I thought I heard something glaring to me, but so I appreciate you mentioned it. No, right. So I would just say to everyone up here, I mean, it's budget season, right? And so I suspect that if downtown was my area, I'd want to maybe you submit something. But I would also say to you, Rachel, that I hope that departments, as you identify, I mean, that's obviously a glaring need, it seems to me. I would hope that you felt empowered to say, hey, we actually need more funding to provide this, and have us make those difficult decisions as to what we're going to fund and not fund and how we're going to go about it.
Yes, it is a budget proposal that's been submitted
Okay, all right.
for additional inspector.
Okay, thank you. The very last question, hopefully a very quick question to answer. Captain Acosta, I was wondering, like you said, there's just some discussions about the foot patrol maybe changing the hours and such. What would need to happen if we did say we wanted it on swing shift? I mean, and I assume that would probably come from all the stakeholders, downtown association, an agreement to saying this is what we want. How difficult would it be to sort of turn the car, if you will, to?
Thank you, Councilmember Jimenez. So a couple things. One, the way they were deployed now was based on, as you know, in the 22-23 budget, those positions were granted to the police department for ongoing 16 positions, right? And based on our recruiting efforts, we haven't gotten to that level where we're going to fund those positions through the police department. And at the time, we were given approval through council to use voluntary on overtime basis to fund those. So that's why I think based on, number one, the need, and two, the ability to fill those positions on a full-time basis. And right now, we're currently filling around about 80%. So I think once those positions are recruited, we're hired and trained, and then the conversations can continue as to how we're going to deploy them, right? So different strategies in different divisions, different areas, again, based on need, recommendations. Some of the high needs areas, they could be crime trends or other things that are factors of how we would deploy them. But that's something we have considered. But right now, we've been deploying them from the 9 to 5.
Okay, thank you. And I would give you a recommendation for an officer by the name of Officer Perales, who would probably be willing to work overtime patrolling downtown San Jose. I think it might be interesting to see that, given that he knows the lay of the land. But anyhow, so thank you so much for the information. I appreciate it. And I'll ask for a motion, or I'm not sure if any. Actually, it seems like we have Councilmember Torres had a question.
Right. No. Yeah. Just so before I do motion, I just wanted to let Blage and those in the working group know that it's very important that we have vehicle payment or parking compliance, especially within our downtown. That's one of the other many complaints that we get into District 3, illegally parked cars, especially in metered areas, or I don't know what they call it nowadays, double crossed parked, illegally double parked, I don't know what they call it nowadays, double parked cars. So that's major concern in our downtown, especially our downtown residents, but also if we want to make downtown bikeable and walkable, a lot of folks are parking in the bike lane, and so that's super important. So with that, I move to accept this report.
Second.
22.
And we have a motion and a second, and hold on, it seems like we're already voting, but I think Councilmember Batra had a comment.
I either like to make a friendly amendment to the motion or make a substitute motion. I'd like to add in there a instruction to the staff to investigate if there can be automatic tracking of the requester's help. The person seeking the help, location automatically investigate if that can be implemented.
Councilmember Batra, are you, just to clarify, for
Yeah.
folks that want to accept or not, are you referring to your comment about giving folks cell phones and how using that as a means of tracking them?
I'm saying investigate automatic tracking so that whether you give the cell phone, because that's a mechanics, right?
Right. Okay.
Yeah. So,
Mr. Chair?
Yes.
So I thought in these bodies we're just supposed to accept the report and not kind of draft or pass policy, just accept the report. That's what we've been told.
Yeah, so this is motion to simply accept the report. So I don't think we can accept additional direction. I would just ask, are you talking about when we are working with our unhoused population and they get into the early coordinated system, that we track them through that process? Is that your request?
no, I was responding to the information which was given before, that certain number of calls came and then we could only find so many people to go and respond and give them the help. And some people we couldn't locate. So I was saying if we have any technology availability to be able to track them, then they would not be lost after making a call. That was the idea. So we can service all the people who really need the service.
And those requests are specific to what service?
This came in the context of, I think it was Path, that they reported certain number of calls received, and then they could only reach so many people, the others were lost.
Okay, I think what would be best for the continuum of care in the county and the early coordination, the early entry system that's coordinated across the county, there are certain metrics that are obviously tracked, and getting those people, I'm forgetting, Kelly, what's the system?
Coordinated entry through the Homeless Management Information System?
Homeless Management Information System, yes. So I think what we could do is we could commit to have Kelly and possibly Reagan Henninger, who's in the audience, set up time with you and walk you through what's currently there. And if you choose to give additional direction through rules, we could certainly be open to that, but want to make sure that, especially since many of you knew, that is actually a pretty complex system, and want you guys to understand it. So I would ask that Reagan and Kelly follow up with you offline.
Okay.
I would say I think that's a good approach, because you can always come to rules and submit a memo. I can tell you, I already have some concerns based on what you're saying, but I think there's just a lot of thinking that needs to happen around that. And I suspect also how complex the system is, that someone's given this some thought in the past potentially, and so.
Yeah, okay. Coming from technology background, know that I'm going to be looking for an opportunity to be able to help, right?
No, totally,
Okay.
yeah. I think it's coming from a good place. I think that's the important thing to acknowledge.
Yeah.
So we'll leave the motion as is, if that's okay?
That's fine.
Okay. All right, so there's motion and a second. I'm not sure if anyone had any more comments. No? Okay, so we'll go ahead and vote. Well, we had public comment at right after the presentation, yeah. So go ahead and vote. It's on your screen. So for everyone that's in the audience, we're using new technology up there, so it seems like everything's fine? Move on to the next item? Okay. So before I go on to item one, because we took D1, we took D2 first, let me just say that we're a little over an hour in, and we're on the second item, so I would say if you have any comments or thoughts, try to be as brief as possible, and I will also take that on my own advice. And so we'll go ahead and invite over folks who want to talk about the Gender-Based Violence Response and Strategy Annual Report. Whenever you guys are ready, feel free to start.
Good afternoon, Chairperson, committee members, and members of the public. My name is Ken Tran, and I am the Unit Commander for the San Jose Police Department Sexual Assaults Investigations Unit. Present with me is our Senior Analyst, Angeli Donzenti, Lieutenant Paul Hamblin from our Research and Development Unit, and Captain Jason Dwyer from our Bureau of Investigations. So today, we are reporting on our Gender-Based Violence and Strategy Annual Report, which includes an update on sexual assault work items, crime statistics and trends, and challenges and recommendations. Now, with that said, I will turn this over to Ms. Donzenti for the presentation. Thank you.
Good afternoon, Chairperson, committee members, and members of the public. My name is Angeli Donzanti, and I am a senior analyst assigned to the Sexual Assaults Investigations Unit of the San Jose Police Department. Thank you to committee and the City Manager's Office for having me here today to present the San Jose Police Department's Gender-Based Violence Response and Strategy Annual Report. After the report, myself, Lieutenant Tran, Lieutenant Hamblin, and Captain Dwyer will be here to address any questions. Today, we will provide an update on the sexual assault-related work items. We'll present crime statistics and trends pertaining to cases reporting sexual assault, then proceed to provide reports specific to the Sexual Assault Investigations Unit, which I will refer to as SAIU moving forward. We will close with the challenges that SAIU currently faces and recommendations to resolve some of the challenges. I will start with Section 1 regarding updates on sexual assault work items for the city and county. Slide 4 summarizes strategies for responding to sexual assault and gender-based violence established in 2020 to execute work items specific to San Jose. Since then, a number of work items have reached completion. Since SAIU's last annual report in 2022, the following have been updated. Line item 1B, regarding department resource cards for survivors of sexual assault, has been updated from in process to completed. The resource cards were printed and officially distributed to patrol. Line item 1D, regarding the provision of sexual assault forensic exams, commonly known as SAFEs, was recently added to reflect an update to departmental policy to ensure that survivors of sexual assault are afforded the option of a SAFE, regardless of when the crime occurred. Please note that the final determination of whether a survivor receives a forensic or medical-only exam is determined by Valley Medical Center. The San Jose Police Department, however, will continue to offer a SAFE to all survivors of sexual assault, regardless of crime occurrence. Line item 2G, regarding trauma-informed care training for all officers, has been updated from in process to complete. Slide 5 continues on with the City of San Jose specific work items. Line item 2H, regarding the substandard housing study, is in process. The RFP has since been reviewed by the Office of County Supervisor Sylvia Arenas and is back with the department for final edits. Myself and the department's fiscal unit are finalizing those edits, and once completed, we will submit the RFP for posting. Now addressing Santa Clara County specific work items, line item 4 was actually completed per the Family Violence Unit and is required to be offered and encouraged in all strangulation cases. Line item 5, regarding the funding of 2 child forensic interviewers to the Child Advocacy Center, has been updated from in process to completed. All Santa Clara County work items are now completed. The next section addresses sexual assault crime statistics and trends. Slide 7 gives you a breakdown of primary offenses categorized as a sexual assault from January 2017 to December 2022. In total, we see that the top 3 primary offenses often committed are 288A, lewd and lascivious acts with a child under 14 years of age, 261 rape, and 243.4 sexual battery. Concerning the increase in 261 rape over the years, please keep in mind that the department implemented the Domestic Violence, Sexual Assault, and Human Trafficking Intersectionality Tool in January of 2020. Since then, SEIU has noticed an increase in reports of historical rape, meaning that when officers respond to calls of service in domestic violence, sexual assault, or human trafficking incidents, the officers are trained to ask the survivor from the intersectionality tool questions specific to past sexual assault. Specifically, question 6 asks, has your partner sexually assaulted you in the past? Question 8, was this incident previously reported? And question 9, have you ever been sexually assaulted by someone other than your partner? And was this incident previously reported? In these cases where the survivor responds yes and has not previously reported the past sexual assault, this will generate a separate case report regarding the historical sexual assaults. From there, further investigation and follow-up will be required, and it's these responses that we are seeing are contributing to the increase in reported sexual assault. Slide 8 focuses on primary offenses categorized as a child molest. These crimes include 285 incest, 288A lewd and lascivious acts with a child under 14 years of age, and 647.6A1 annoy or molest of a minor. From 2017 to 2022, on average, more incidents were reported during the school year than summer and winter break months. The reports coming in also reflect that more incidents of child molest were reported within 0 to 10 days after the incident occurred. With respects to the category of rape, on average from 2017 to 2020, more incidents were reported during the months of July through October, and majority were also reported within 10 days or less after the incident occurred. Slide 10 reflects the count and a heat map of age of survivors. Overall, it's important to note that in juvenile survivors aged 0 to 17 in total, they make up the majority of survivors of sexual assault, followed by the 18 to 29-year-old age group. Slide 11 reflects the top 20 zip codes in which survivors reportedly reside. The top 3 zip codes where more survivors reside include 95112, 95122, and 95116. Slide 12 breaks down the ethnicity of survivors. We see that survivors of the Hispanic and Latino demographic make up 54.3% of survivors. Please keep in mind that historically the Hispanic population of San Jose has made up the majority demographic group in general. It isn't until the most recent census that the Asian demographic surpassed the Hispanic demographic, now making up 37.5% of San Jose according to the Census Bureau, and Hispanics make up 31%. With that, we understand the concern when seeing Hispanics making up the largest survivor group demographically. However, we also need to take into consideration why survivors of Asian descent still remain an underreported population. It is in the Santa Clara County Work Item 3, which addressed the department's ethnic-based agency work plan and build-out that addressed this concern, and the department continues to work with those community-based agencies, specifically serving communities of Asian descent, to break down barriers to reporting sexual assault and to eliminate the stigma and shame that is felt with reporting. Section 3 will address SEIU specific updates. SEIU has continually worked to improve how we serve survivors of sexual assault and remains committed to investigating cases to its fullest. From 2017, and with the provision of more detectives assigned to SEIU as a form of resource, SEIU has increased its submission of cases to the District Attorney's Office by 105%, and altogether stopped closing out cases due to lack of investigative resources for the past 2 years. 639.3% increases of reported cases closed out as transferred to other agency can be attributed to the increase in reported sexual assault from the intersectionality tool capturing more reports. Since SEIU's last report in 2022, the three-pronged approach addressing the Sexual Assault Bill of Rights has been completed. SEIU was awarded 2 grants in 2021 addressing the SAFE, the Sexual Assault Forensic Exam backlog. The smaller grants in the form of $45,000 address the backlog of SAFEs received from 2016 to 2018 to keep the department aligned with the law that was updated in 2016 requiring that all safes be tested. These safes have already been submitted as of last year to the Santa Clara County Crime Lab for testing and are in the process of being returned back as testing completed. The larger grant in the form of $1.4 million will address the safe backlog prior to 2016 and will continue to be a long-term project still currently in the early stages as the department works to procure through RFP a third-party lab to test the backlog. I will now close with challenges and recommendations moving forward. SEIU was not awarded the Office of Violence Against Women in the grant in the form of which funds SEIU's in-house YWCA advocate. The in-house YWCA advocate in the form of provides services in the form of counseling and medical and legal advocacy, to name a few, which are integral components to the services provided to survivors of sexual assault. As a result, the department submitted a budget proposal last year requesting ongoing funding for the in-house advocate, which is currently in phase 2 of review. Additionally, SEIU, along with the Special Victims Unit, rely on one analyst to supply data for data-informed decisions and to coordinate programs specific to SEIU and SVU in addition to the general tasks and responsibilities of an analyst. Last year, SEIU and SVU submitted budget proposals to fund additional analysts. Moving forward, SEIU will continue to support and partner with the department's Crime Prevention Unit to provide intervention and prevention services to communities experiencing higher levels of abuse. The Crime Prevention Unit has done a remarkable job in going out to the communities and educating citizens regarding how to report incidents of sexual assault, the process in developing connections and rapport with the community so that citizens feel more at ease when reporting to the police. SEIU will also continue to work with ethnic-based agencies to support communities of Asian descent to ensure that they are aware of the services that can be provided to them and to build a rapport to remove the cultural stigma and shame that is felt regarding taboo topics such as sexual assault. In closing, thank you, Council, for your time and attention to this important topic. Again, myself, Lieutenant Tran, Lieutenant Hamblin, and Captain Dwyer are present to address any questions.
Thank you all for the presentation, for the information, Ms. Dansanti. We're going to go to public comment, see if we have anyone in person or online.
Blair Beekman.
Standards and practices in my youth. They've grown a little fuzzy, and so this work is helpful to me. Thank you for the work that you do. I think gender-based violence and overall hate violence, they may be a bit separate, but they can be, sometimes the same thing. involved. I think a lot of it comes from people simply not understanding how people want to live their lives, and kind of the policies we're creating so people can live their lives as they want to. We have to make a real concerted effort to continue to make that clear to people. What are the practices that people want to live their lives in and around? We pushed through some really good policies in the past 5-10 years. We have to spend the next 5 or 10 years really clearly explaining those policies and those ideas. I think those are the ways to help fight prejudice and to really address people who are just not understanding why people have made the lifestyle choices they have, and why is government allowing those lifestyle choices to take place. We have to learn to make that clear and acceptable and good for ourselves. We don't know how to quite do that yet. Good luck how we can do that. Boy, I really hope we can do that in the upcoming years. And we've defined policy. Now let's hope we can define day-to-day societal living and really work out some really good things for people. Thank you.
Back to the committee.
Okay, do we have any questions from committee members? Sorry, I don't see. Anyone have their hand? Just go ahead and speak. Mr. Batra, you have? Okay, please.
Need to get my speaker on. Okay. Thank you for that report, detailed report. One area of clarification, you mentioned something about the sexual assault and domestic violence in reporting. You changed some way of investigating them, and as a result, there's some changes in the number of cases being reported?
Thank you for the question, council member. So to clarify, that is with regards to the domestic violence, sexual assault, and human trafficking intersectionality tool. It was implemented back in 2020 in order to capture instances of either domestic violence, sexual assault, or human trafficking that may otherwise not have been captured prior in those incidents. So it's an improvement to the way the department is trying to serve citizens of San Jose, as well as it will cause an increase in reports of sexual assault. However, that is what we are seeing. So those big changes is that when we ask a victim or survivor of intimate partner violence in a domestic violence situation, have you been sexually assaulted in the past, and it has not been reported before, and the answer is yes, that will generate a new report for us to investigate, therefore increasing reports of sexual assault. However, those reports are of historical sexual assaults. And I have our Bureau of Investigations captain as well to elaborate in case.
Okay, so when is this intersection tool implemented? When is the first time we are seeing an increase in number reported because of the tool, not because city or the residents became more violent or more sexual assault, but it's a matter of catching up to the reporting. When did we start doing it so that we can interpret the numbers correctly?
That's a great question. Absolutely. We started seeing it right away with the use in January of 2020. And so since that, the increase of reports have increased the reports of sexual assault. And I believe we had reported that also in February with Lieutenant Hamblin at the last PISFIS, who addressed that increase in 261 rape in particular.
So when we compare numbers of 21, 22, 23, they've been all using the same methodology, right? Okay.
Yes.
Yeah. All right, thank you.
Okay, next we have Councilmember Duan.
Thank you, Chair. Thank you, Chair. Rape have increased, and the reporting time of rape, has it decreased or increased, or improved, if you will? The reporting time from a victim.
So based on historical times of reports and measurement of time, we see that reporting time has improved through prevention and education efforts and encouraging survivors to report at a faster time so that we can first assessed through a SAFE exam, a sexual assault forensic exam, to capture evidence, as well as gather any other investigative details required. We've seen that change over time where there's been delays in reporting. It used to be over 30 days for adults specifically to report incidents of rape. And as you can see in today's report, it's kind of switched over to 0 to 10 days.
Thank you. I have one more question. Child molestation or higher when kids are in school. Why is this? And what are you doing about it?
So with respects to the child molest category, it's not that child molest is occurring more during the school year, it's that children are going back to school and there is a person to report at school, whether it's a counselor, a teacher, social worker, there's someone to tell and there's someone available who may be one either noticing changes in a child's traits or personality, maybe seeing terms of isolation, and maybe concerned in addressing those issues. And when confronted, those are what starts to increase the reports of child molest during the September through May school year. And as you notice, the opposite happens during summer and winter breaks.
Thank you for that answer. That's all I have.
Councilmember Torres?
Yes, so thank you so much for this report. I think this is very important, and I've actually been in these conversations. So it's one, it's particularly hard to see that our Latino community is reporting the incidents, and I think that's no surprise because I know that we've had council members like Councilmembers Arenas and Carrasco and Esparza and other Latino elected officials on this board who have pushed for our community to report these atrocities, unfortunately. And it's very unfortunate that it happens in our community, right? Child molestation, sexual assault of our children under 18. And so it's good to know. Very hard to digest though, but very good to know that Latinos are reporting. However, what particularly concerns me is our underrepresentation of our Asian and American Pacific Islanders community. Are we doing just like we did with the Latino community? Are we doing like a concentrated effort to make sure that they are reporting this? Because I know, I'm Latino. It's happened in my family. Time and time again, our kids are told, stay quiet, blah, 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 it's taboo. But now we're seeing that our Asian community is not reporting as much as a Latino community. Is there a concentrated effort?
Thank you for that question. The answer is yes. We are working with our service providers within the Asian communities. Right now, it's within the Vietnamese communities. We are doing outreach. We have programs. We have officers going on radio talk shows on a weekly basis to raise awareness sexual assaults. And we are working with our crime prevention unit, going out to the schools and focusing on within our Asian community to raise sexual awareness.
Great, thank you. I know, this is a very, like I said, a very hard pill to swallow. Especially in our communities where we want them to thrive. We want our young women and young, even men, right, to thrive. So this particularly, hard topic for all of us on this and in our community. So, thank you so much for doing the work. I've said it more than a few times here. I'm gonna just give you a hypothetical. If when let's say a lesbian couple, if a lesbian couple has some type of disturbance, right, and one of the partners is claiming sexual assault, or it may be somebody who's trans, right, trans woman, or non-binary person. What are the steps? What steps are taken to ensure their safety, because I know that we don't report it. I heard it at the last PISFIS, and we've been super busy, and I definitely want to still follow up with our SJPD about that, since we have no data on gender violence towards our LGBTQ and gender nonconforming community. What are the steps that we take to keep our LGBTQ folks safe?
Thank you for that question. I could tell you that we treat all our survivors equally, regardless of the sexual identifications or age or race. But what we do have is we do have an allied officer program. And what that is an officer will train the sensitivity needs of our LGBTQ community. So that adds a layer of comfort in the sexual assault reporting process. So our officers are more sensitive to the need of our LGBTQ communities when they're interacting, when they do the investigation process. They know how to ask questions and how to treat them. And that is what's been done, and all of our officers have been trained. So, and we, with the Allied Officer Program, we have officers who are trained and ready would need to, in instances like what you described, we can ask for someone to come who's been trained, who understands the sensitivity, and come and talk to the survivor.
Okay, great. Thank you. And with that, Mr. Chair, I motion to accept the report.
Second.
There's a motion and a second, and Vice Mayor Kamei is next. She has a few questions.
Thank you. Thank you for your work. This is really, really important work. I was curious to know a little bit more about your recommendations where in your section of challenges and moving forward in terms of looking at additional help. And you mentioned how additional analysts would be helpful. How many do you have now? Do you have a few, or? I'm just wondering what the difference would be even if you had one more FTE, because I think that given that there are so many competing needs, so I just want to know, what do you have and what would one more mean?
So currently, the analyst is me. So you're looking at me?
That's it?
Yes.
Okay. So you'd double what you could do even if you had just one more. So I'd ask that we take a note of that because I think that this is an area that for too long has been put in the back burner. And I know that there are a lot of important things that need to be addressed, but certainly if you only have one and you could have another one, you could almost double what your capacity. So I just wanted to see what that was. And there was another area that I thought that not having a full-time advocate assigned, is that separate?
Yes, that's separate. And currently that budget proposal is already in phase 2 in review.
Okay. Well, I personally think that's critically important because I think that this area, as I say, has been sort of in the back burner for a long time. And I think that it from the previous reports, it seems like a lot of progress is being made. And certainly I would ask consideration for it being moved forward. Thank you.
Thank you. I think Councilmember Duan had an additional question.
Yes, I do. Thank you. So Asian and Hispanic women will not report sexual crime due to the fact they're feeling shameful of themselves, family, community, and especially afraid of retaliation. What are we doing to encourage the reporting?
Thank you for that question. I think the best effort that we can do is continue our efforts to do raise awareness, make it easier for survivors to come forward, to disclose, to report, and we can improve our process where there are different places where survivors would feel more safe, more comfortable to come forward and report. And I think that would be the best effort that we focus on.
Is there a program that written in multiple languages to include website, phone numbers to report, like in all of the restroom stalls or any, outside of any restroom and in restaurants and so on?
So, council member, the multiple languages are actually offered in different types of programs offered by the San Jose Police Department. First is called the Vigilant Parent Initiative Program, which was in the City of San Jose work plan. It's currently in progress and continues to be taught in schools in San Jose to parents specifically about how to protect their children online from online dangers, specifically sextortion and child sexual exploitation that can occur online. That program can be offered in English, Spanish, and Vietnamese. The information cards, the brochures, the sexting info cards are provided in multiple languages to include English, Spanish, Vietnamese, Hindi, Korean, Tagalog, and Chinese, if I have everything correct. And then, in addition, our crime prevention unit has multiple program classes in which they have specialists, dedicated specialists that also speak multiple languages addressing those communities. And then in terms of stalls, you asked a question on stalls and information. The human trafficking detail had completed a billboard campaign 2 years ago. Part of that campaign was we reached out to SJC Airport and had human trafficking posters installed in the bathrooms, if you haven't seen them yet, in each of the stalls, both men and women, in multiple languages, addressing the same languages that I had listed.
Yeah, I've seen them in the airport restroom and so on, but many restaurants, we do a great program with the health department, Wash Your Hands, right? You see that everywhere, and you see it in multiple language. I wonder, can we piggyback and put similar things in 3 different languages for women to report?
Oh, thank you for that suggestion. Certainly, that is something we can look into and see if we can implement something like that.
All right, thank you very much.
Councilmember Torres had one
Yeah,
question.
just follow up real quick, and because I know we want to keep moving on. I totally forgot to ask. I saw the zip codes. Unfortunately, it's the zip codes where we have probably our largest undocumented immigrant community. What does the city do to help them start the process for a U visa if they are a victim?
Councilmember, I have to tell you, I do not know the answer to that question, but I can look into it and report back.
Please do. That's very, very important. Yeah, that's very, very important. If an undocumented immigrant in our community is a victim of any type of violence, they automatically get assistance to get temporary citizenship. So that's definitely important to know, and definitely important that we need to follow up on.
I couldn't agree with you more.
I just have one quick question on slide 14, if you're looking at the table where it says count of SEIU internal case status. So as an example, if you look at the second line right below DA submission says lack of investigative resources. You go across, well, actually, let's go to E, all leads exhausted. So the third line. If you go across the 2022, it says 451. And then you go down, 1986 is the total of all those. So should I interpret that 1986 as 1,986 cases for that year? Is that the correct way of seeing it? That includes the whole sort of column in 2022, 1986?
For that year, yes, correct.
So for that year, that was that many cases, and then, okay. And then the DA submissions, it seems like it's inclusive of everything, right? As the note suggests down there. Do we have just a rough sense of how many cases are rejected by the DA that they say, hey, there's nothing here, in their opinion, right? There's nothing here, we're not going to file. I know that's inclusive in the 1092 for 2022, but do we have a sense as to how many of those are?
So I do not have that number off the top
Okay.
of my head, but
All right.
because it is inclusive in the DA submissions, that's something we can report
Yeah.
back to you.
Okay. All right. Okay, thank you. And then I think we have a motion and a second, and no one else has any. We'll go ahead and vote. And thank you. I think everyone's voting. Thank you so much for the presentation. We appreciate your efforts. Thank you. We're going to move on to item D3. Again, I think we're going a little slower than we typically do, but all this is important stuff. So, I totally understand we had a lot of questions. Item D3 is fire department call volume status. It's going to be to accept the report on fire department call volumes, including opportunities to triage calls for service so that resources can be maximized. So, Chief, welcome.
Good afternoon, Chairperson Jimenez, committee members, and members of the public. My name is Mark Thomas. I'm a captain with San Jose Fire Department. I'm here today with Fire Chief Robert Sapian to present on item D3, Fire Department Call Volume Status Report. The fire, just please note that where it says increase, the population actually decreased on the slide. The fire department experienced a significant rise in call volume in fiscal year 2021-2022. This chart shows our call volume in relation to the city's population over a 5-year span. During that 5-year span, our population had decreased 7.1%, while the demand for emergency response increased by 11.4%. This is contrary to prior years' experience where call volume trended correlarly to population growth. In fiscal year 2021-2022, call volume increased 9% in calls, resulting in 103,145 unique incidents requiring emergency resources. The chart presenting on this slide is a breakdown of our call responses citywide by battalion. Our current organizational structure is designed for our battalions to cover geographic regions of the city. Call volume is highest in the core of the city and lowest at the perimeter or edges. As you can see on this chart for Battalion 1, located in the central core of San Jose, they experienced the highest call volume in fiscal year 2021-2022 with 26,546 incidents. It is important to note that each call only represents a response and not the number of apparatus or personnel needed to mitigate the emergency. An example is a typical structure fire requires 9 apparatus to respond versus a medical emergency that would typically need a single company to respond. Here we're highlighting the individual station call volume by battalion. Note that Fire Station 37, located in Willow Glen in Battalion 10 area, was placed into service in May of 2022 and represents under 2 months of responses. The busiest stations by battalion are identified in this chart. The following heat map depicts the call volume intensity ranging from the lowest in blue towards the perimeter of the city to the highest intensity in red at the core of the city. Current station response area call volumes result in a reduced resource availability and compromised response time performance. Here we show a similar map reflecting late responses citywide, travel time greater than 4 minutes. The late responses are indicated by green, the lowest intensity of late responses, again towards the perimeter of the city, to the highest intensity of late responses in orange at the core of the city. This map depicts how resource drawdowns impact response time performance and aids the department in placement of new fire stations to provide coverage to those areas utilizing proceeds from Measure T funding. This will result in the building and placement of fire stations 32 and 36 to strengthen central response capabilities and improve call volume distribution. The pie graph shown here captures the breakdown of call types received by the fire department in fiscal year 2021-2022. We noticed no significant increase in the proportion of medical call volume compared to other call types year over year, as we closely monitored this since December 2020 due to the spike in COVID-19 cases. Each call type was within 1 to 2% of the prior year's call distribution, with a slight increase in fire incidents and decrease in false alarms, false calls, and medical emergencies. This graph compares the volume of EMS responses to the other calls for service within the fire department. The department experienced a 10.5% increase in EMS calls from fiscal year 2021-2022 from fiscal year 2020 to 2021, and a 15.5% increase in all other types in that same period. The department is continuing to identify drivers of the increased EMS activity in this period. The California State Plan on Aging report from 2021 stated that we will have a significant increase, near double, in residents above the age 65 by 2030, and increasing by more than 200% by the year 2060. As shown in this chart, in fiscal year 2021-2022, 52% of our EMS calls were for patients 60 and over, and 66% for patients 50 and over. Fire dispatch will continue to utilize the best resources by triaging the 911 calls with medical priority dispatch systems, which allow the dispatcher to use a set of questions based on the medical complaint. This information is gathered during the call taking, which aids the San Jose Fire Department, paramedics, and EMTs in treatment of life-threatening emergencies. In conclusion, the department will continue to monitor call volume and to identify areas to improve response and service to the city of San Jose. I want to thank the committee for your continued support to the fire department and our ability to deliver services to the city of San Jose. The fire chief and I are available for any questions from the committee. Thank you.
Thank you so much, Captain Thomas. We're going to go to public comment, either in person or online, and then we'll come to the committee.
I'm just giving a second. There are no hands up.
Okay, we'll come back. Let me see the raised hands. Did you have a? I do. Yeah. Go ahead, Councilmember Dwan.
Thank you, Chair. Thank you, Fire Chief and Captain Thomas. Do you have any data for Station 37 on the amount of calls since the station been open since May of 2022? We're 10 months in, the amount of calls that they...
Thank you, Council Member, for the question. We do not have a full year's data, which is what we would pull for the information. However, we did model the response area prior to opening the station. We did estimate that it would be somewhere between 2,800 to 3,000 calls annually. We're waiting for a full year to see if that's confirmed.
Thank you, Chief. The amount of call volume continue to rise. And unfortunately, I'm part of that baby boomers, and I'll need some care somewhere down the line. And what are your plans to increase the amount of personnel or station for the future of the fire department?
Our in-progress plan is related to the prioritization of stations that are funded by Measure T. As you are aware, Council Member, that initiative enabled us to schedule projects that included Fire Station 37, 32, and 36 as new fire stations, and to replace existing structures, which include stations 8 and 23. In addition, working with council, particularly on response time challenges, Station 20 was altered to include a landside bay and an additional response area in the city. I think going forward, the strategies will have to be the same: ongoing analysis of response time performance, identifying service area gaps, which we do have, as we articulated previously in our station prioritization. There are other gaps that won't be met by Measure T projects. The plan for the department is to renew its area of or standards of cover analysis so that we can come back to council and share what those gaps are.
Thank you. And as we open up these new stations, I know that we have a Station 33 specifically. The residents up there, they pay a very particular tax and to have that station built. And so I get enormous amount of phone calls and when is Station 33 will be back in operation?
Thank you, Council Member. For folks new to the committee, Station 33 was closed due to budget action as we dealt with the recession years. It has remained unopened principally based on our response time performance analysis. In other words, we identified areas that were suffering worse service than the area served by Station 33, and that's why we prioritized opening of either new companies or restoration of companies to those areas. One consideration for Station 33 over time, certainly it has been significantly developed since we closed it, and there are far more residents there. However, there will be a road built down to access Kirtner, which I think will make it a more viable service area and help with the area response times as well. So I think we've primarily been watching that road project to see when it can be completed.
I understand that, and again, the residents up there in Communication Hill is highly upset that we staff new station, and I understand the fact that the dynamic deployments and so on. But it doesn't take away the fact that it's Station 33 Communication Hill is a pretty hard to reach area, and not to have some type of staffing up there, it's not serving the residents. On another note, there is a huge problem with our paramedics working in mandatory overtime. What are your plans to resolve that? And I know that council have extended the contract, but still we are unable to recruit or retention of our paramedics. What are your plans to help alleviate that?
Thank you, Council Member. And as I'm sure you see in the work plan, we do report in the fall on our staffing levels and recruitment activities. However, I can tell you that we have specific focus today on the paramedic shortage. As I know you are aware, when lockdown occurred in March of 2020, the department made a decision to continue its internal training of firefighters because we thought there might be a problem with attrition and not having enough staff. However, what was not anticipated, and this is now a national issue, is that education facilities, particularly those requiring internships and clinical components, were stopped. And so right now, my peers across the state are all struggling through the same issue. In the fire department, we have, I would say, 4 principal strategies to address your question. One is We have initiated lateral paramedic hiring, meaning we're hiring firefighters who work in other departments who are paramedics. Secondly, we are activating our bench, if you will. We have quite a few paramedics who are not practicing in the department, and so we're employing them to help give some relief to our frontline paramedics. And then finally, we are engaging regionally to see if we can't stand up paramedic schools here in the county that will serve us not only for the immediate need, but long-term as well.
Thank you. My suggestion, Chief, is have you thought about the fact to extend the nautical miles requirement so that way we can attract more paramedic regionally?
I understand that issue has been raised as a concern. It is a requirement contained in the memorandum of agreement between San Jose Firefighters Local 230 and the city. I'm generally not a party to those negotiations. However, I am aware that that concern has been raised.
Would you be, I understand that you're not part of that memorandum of agreement, but would you support that would create or latitude to reach out to more candidates?
Councilmember Duan, if I can just interrupt, I don't know if we're starting to go into the space of bargaining.
Yeah, I would.
Sorry.
Yeah, I would. We'll be coming to you in closed session around negotiations as we kind of outlined on Tuesday, and I think those would be more appropriate questions for closed session as we head into negotiations with Local 230.
All right. Thank you.
If Councilmember Torres has a question?
No question. I want to thank Councilmember Duan for actually asking some of my questions, and they do have to do with paramedics. We do know that obviously that 61% of the calls are medical, and so you answered some of it, but looking forward to further discussion on retaining paramedics and hiring more paramedics. I think I have been really adamant on letting our human resources department know, or Jennifer know, that when we continue to talk about hiring and retaining in the three critical departments in our city, that we need to add fire and paramedics. So that's very, very important. I know that we are understaffed in our fire department, especially within our paramedic ranks. And so with that, I motion to accept this report.
I'll second.
Okay, and then we have Councilmember Batra.
Thank you for the report. Your emphasis on, Chief, in the very first slide is about the population increase and then the call volume increase on the EMS side. Okay, do you have any more to comment on that one? In terms of, is it the population increase? Is it the senior population? Is the junior population or the childhood, or what is any further granularity on it?
Over many years, 10, 15, 20 years of analysis that we've looked at, there seems to be a very clear corollary between population increase and increasing call volume. As we've exited COVID, it seems like we seem to be in a different place. I don't have the data to say that it is exactly COVID related, although it does appear that there has been some impact. We have been beginning to evaluate some issues, and we've confirmed with our ambulance provider that part of the challenge could be that ambulance companies are no longer serving interfacility transports, which means those facilities opt for other ways to get their patients to the hospital, and that can be the 911 system. We have been in conversations with American Medical Response about that issue. Also, We're looking to advance a public education campaign as well. We think that it could be a maintenance issue. In other words, reminding our residents on when to call 911. And I think ultimately the lesson is that we are in many ways the safety net for the community for almost all services. And when someone needs help and doesn't have an access point to assistance, 911 becomes the system that is used, and we become the responders. I think it's a combination of many factors, and I think those are some of them.
Okay, all right, thank you.
We had a comment from Councilmember Torres.
No, Captain, I don't want to demote you. Chief, so you just touched up on the PSA. So I think we need to take it a step further. I've noticed that when I'm on the passenger side of my best friend's ride, that people don't pull over anymore. And I've literally told my friend, the person I'm traveling with, I said, those are sirens. And I've been literally told, oh, we still do that? I'm like, yes, of course we still do that. I mean, like, I'm a council member. We need to pull over. What are you talking about? Those are our firefighters trying to get somewhere. But literally, nobody pulls over anymore. How can we make sure that our community is pulling over?
Thank you, council member. We do currently do intermittent PSAs via social media with graphics on pull to the right so that we can, and we try to do them in multiple languages. It is a challenge that has, I think, increased in the last decade or so, but certainly your point is well taken that continued education on that front. We have done some regional work as well, particularly with Santa Clara County Fire Department, where we've shared resources to push that messaging. But I do think there is ongoing education that can benefit us in the way of making sure that people are calling 911 when they need to, certainly the traffic law education, and many other fire prevention and public safety messages. And we do actively try to frequency them, but certainly we can emphasize some as well. Mm-hmm.
Thank you very much. I just had one question before we vote. You know, on slide 4, where obviously we have an aging population. So I'm going to state how that relates to slide 4 in my question. So we have an aging population, and so what I'm curious about is there a way to overlay where that aging population is, how it translates as to what battalion it's going to affect most? Have you looked at that data?
I think I'm going to start, I'm going to answer by saying I have not accessed that particular data point. However, I have played a little bit with our budgeting for equity tools that are now available to us to see what kind of demographics we can pull. Certainly, we can do it another way through the backside of our patient contact records, where we gather some of that information as well, and that will tell us.
I'd just be curious, right?
Exactly.
Like if,
yeah.
So the impact would be dramatic, right? If Battalion 1 or Battalion 2, which has the most calls for sort of the response area, right, has the greatest need, and then that's where the population's increasing, I mean, it's going to get hit hard, right? And so trying to think about that. I just wanted to put that
Yeah,
out
we
there.
can get a finer look at it. Of course, we know that in Evergreen, for example, we know that the Villages has an age restriction for residents, so we know that that'll be a high area. But we can really try to get that to a more granular
if you think
level.
it's worthwhile. I just wanted to ask because it really stood out to me. But thank you, Chief and Captain. Thank you for the presentation. I think we are all done, so we're going to go ahead and take a vote. Unanimous vote. Thank you so much, sir. We're going to move on to our last item, Innovation and Technology Project Status Update Report. It's to accept the status report on innovation technology projects, highlighting the condition of efforts, initiatives at risk, along with mitigation steps and contemplated projects. Let me just say before you get started, I think it was pretty cool to see actually photos and that you shared in the slides of the team members and stuff. It's not always that we get to see everyone that works on stuff, so thank you.
Good afternoon, Chairman. I'm Chairperson Jimenez, council members, members of the public. My name is Khaled Taufik. I'm the Chief Information Officer in the Information Technology Department. And with me is our new Assistant CIO, Jim Bursig. Jim joined us recently, earlier this year. And also presenting with us is Shirley Young, Project Manager in ITD. And we are here to provide the Innovation and Technology Project Management Status Report. We will focus our presentation on providing background information regarding the development of the portfolio project management team, status of priority projects, and share the projects and San Jose 311 performance dashboards. In 2019, the city auditor provided the Information Technology Audit Report that helped define the Information Technology Department's role in managing priority projects by enhancing the city's project and help define the IT's role in managing priority project by enhancing the city's project development and management practices. The Portfolio Products and Project Management Office was created to mature the city's ability in managing IT projects. The focus efforts resulted in achieving 74% project success rate in 2022, a great improvement compared to the 5% success rate back in 2016. The department established a performance goal to achieve 80% of its IT projects. Project success is measured by the schedule, the cost, the scope, and the value, and completed projects are tracked with the status of success or improvement needed. This tracking allowed for the tracking and monitoring of projects to ensure continuous improvements and enhancements of the process. Project managers collaborate with departments to establish a roadmap for technology investments and manage projects that meet one of the following conditions: exceed $500,000 in value, involve more than one department, require a multi-year implementation schedule, or if the project is considered to be of high profile or sensitive. Jim will provide additional information regarding the 2019 audit.
Thank you, Khaled. Good afternoon, Chairperson Jimenez, committee members and members of the public. My name is Jim Bursig. I'm the new Assistant CIO, and it's truly a pleasure to join the San Jose team. The 2019 Technology Deployment Audit helped define the Information Technology Department's role by assessing the project management effectiveness of high-priority projects. The outcome of this was, one, ITD's agreement with the audit findings, and two, that ITD has recently implemented all of the audit recommendations. Actions taken included the creation of City Policy Manual 1.7.2 on technology and management deployments, which expands ITD's role citywide and to implement requirements for key project management practices such as project status reporting, like the meeting we're in today, and maintaining a citywide project dashboard which depicts each project's status and other project-related information to promote transparency and public engagement, and conducting independent project reviews for projects considered critical, high risk, or high priority. This slide shows how we're connecting and aligning IT projects with the city roadmap across city priorities. The 13 highlighted 2022-23 initiatives depict ongoing IT projects linked with the city's approved initiatives roadmap and reflect strong business and technology alignment. The ITD team actively supports these projects by providing innovative solutions, project management, new technologies, and critical data. Here is the current roadmap of the major IT and innovation projects across the city with an updated project status to provide an overall visual representation of our progress. Project status was updated since the December 2022 update to the Smart Cities Committee. The highlighted completed projects are in blue, on-track projects in green, projects that need mitigation in yellow, and projects needing action in red. We continue to address issues to ensure the 30 critical projects are on track. Thank you, and I'll turn it over to Shirley Young to discuss our project statuses.
Right. Thank you, Jim. Good afternoon, Chairperson, committee members, and members of the public. My name is Shirley Young, and I am a PPM from ITD. Here is the project summary showing how we're making progress with more projects on track and fewer at risk. As a note, the previous slide showed only projects on the city roadmap, and what you see here is an exhaustive list of key technology projects. On this slide, we are highlighting some of our major projects and their statuses. A few to point out: Vehicle Blight Management System and SJ311 accessibility are experiencing some delays due to limited resources and some delays in the design process, but it is being actively mitigated. And as you can see, the rest of the projects on the slide are on track or they're just starting out. On this slide, you will see our recently completed projects. We've completed a total of 8 projects. A few projects to highlight on this list: the Affordable Housing Portal, or Project Doorway, gives prospective tenants the ability to find and apply for affordable housing in one central system. Hybrid work environment are the TVs and telecoms you see on each floor in City Hall, and 311 dashboard, where we are now tracking performance metrics. I'll now hand it over to Khalid for a deeper dive in the 311 performance dashboard.
Thank you, Shirley. The recently updated San Jose 311 dashboard improves the visual presentation of data and allows viewers to analyze how services are requested by district and service type. The dashboard provides the option to customize the information based on service type, service location, impacted district, and date range. The dashboard was also updated last week to incorporate the customer satisfaction rate by service type, data, and district. Currently, the city's overall customer satisfaction rate is at 64%, and the goal is to achieve 80%. Several projects and initiatives are currently underway to help improve customer service and achieve a higher customer satisfaction rate. Shirley will discuss the IT project dashboard next.
Thanks, Colin. Here's our dashboard on all key technology projects. This is a high-level dashboard showing key metrics such as project status, budget, completion date, and more. It is available publicly on our IT website, and it is fully interactive, so any metric can be toggled for different analysis and insight. This is the second dashboard that complements the first one in the previous slide. It is a more in-depth view of project details. It includes description and not only overall status like the previous slide, but status is drilled down further by different components such as schedule, scope, and budget. This is also interactive. Users can drill down by the filters on the left. And again, this is publicly accessible on our IT City website. I'll now hand it over to Khalid.
Establishing the Portfolio, Products, and Project Management Office proved to be effective in advancing the city's ability to implement innovative projects successfully. The programs continue to mature and advance as we enhance project management processes and tools. As we continue to expand our investment in developing the team and enhancing processes, we will also invest in sharing our experience with other departments to maximize the benefits and establish consistency when managing IT projects. We are currently recruiting 2 vacancies in the team consisting of the division manager and the project manager. We expect to fill the 2 vacancies within the next 2 months. This concludes our presentation, and staff is available for feedback and questions.
Thank you so much for the presentation. We're going to see if anyone has comments online.
Blair Beekman.
Hi, Blair Beekman here. Thanks a lot for this item. I'm really impressed with how this item was talked about in IT today. there was, or about IT subjects. I mean, these are more internal practices and needs and fulfilling your needs well, it sounds like, and that's good to hear. And it was mentioned in what the ways of doing things well at this time was a portion of describing, having an open accountability sense with the public and a transparency sense and an accountability sense. And that was incredibly nice to hear because I think it could possibly show yourselves what the range of what tech accountability and good oversight practices really works towards as a whole community process. It's not just a small isolated thing. It's a way to really build many parts of our community and our future. And it sounds like IT is taking advantage of that and learning how to use that. And when you do, you have more choices available to yourselves how to more creatively think of issues, which is what we really need. And to think of issues in terms of civil rights and civil protection ideas, openness, accountability, communication with the public more, those are great skills to know how to have. And just to thank you, IT is taking advantage of that. That's going to create better practices within what they're doing. And thanks a lot. Hopefully, one more thing to add, a good reminder for new council persons to really check out what they are doing internally in government with these sort of items and how open accountability practices are of help to them and how that process can grow. Thank you.
Back to the committee.
Thank you. I think I saw that Councilmember Batra had some questions. Go ahead, sir.
Thank you very much for this IT report and hearing that the project management has improved the delivery of the projects and more completions in time. The one question I have for you is, you have some projects marked as action needed and the other ones are marked as mitigating. Could you explain what is in the action needed category versus what is mitigating?
Sure. Thank you for the question, Council Member. If we're mitigating, that means that there may be actions that we are perceived may happen or are preparing for that may never happen that are preparing for. If action is occurring, that means we're actively taking action on a project to ensure that it gets back on track.
So is the action needed one a little more clearer versus action mitigating, the mitigating one?
So the actions being taken are for real.
It says action needed, so I'm just using your terminology to understand which one is in a worse state. Is it the action needed one versus?
Correct. Action needed is the worst state, yes.
Okay. Okay. So it's great to see that you have put all your IT projects in line with the enterprise priorities, which is good to see that where we are able to focus and all that. So this is a very, very good representation of the work. Otherwise, if you just present your IT projects, doesn't give you a balance of where one is going. So I think this is a great presentation in that regard. And thank you very much for putting it together that way. And I will make the motion to accept the report.
Second.
Okay, thank you. And Councilmember Duan has a comment?
No, I just want to say thank you for your hard work. We're here to support you, and with all these accomplishments, I appreciate that of your hard work. Thank you very much.
Okay, seeing no, Councilmember Batra, you had another question?
No,
Sorry,
I already raised the motion, and
okay. It's just so when the microphones are on, whether you have a question or not, it pops up on the screen, so that I just assume you have a question. So no more questions. We'll go ahead and take a vote. I suspect it's a unanimous vote. Well, thank you very much for the presentation. Appreciate your time, and I'm sorry that you had to wait a little while. We asked a lot of questions today, so thank you. Have a nice day. We're going to go ahead and move to open forum. Do we have any speakers in person or online that want to make comments?
Blair?
Hi, Blair Beekman here. Congratulations to Councilperson Jimenez for becoming chair of PISPIS. You did good on his first day. I'm sorry that my public comment may have been off a bit. You guys have very serious subject matter on to deal with gender violence issues. I offered an approach that hopefully can be helpful, but it was a really heavy issue what you guys were working through, and good luck I just brought up simple ideas of basically citizenship and policy that hopefully can be of help to really deep issues, and can be hard to do that. Good luck with that. I spoke at the end of Rules and Open Government yesterday. Talking about things I'm working on, and I opened up a question that is pretty large, and I think relevant to this situation, that not only with the gender violence issues, but with hate violence issues, we just have a real lack about how to be more honest and clear about events, about world events, and what exactly our situation is in this country. And that's promoting and adding to ignorance and people taking it out on people when they shouldn't. And we have to really learn how to be clear what exactly is going on in this world. And we don't want to do that. I don't know why. It can really work towards concepts of peace and not war. And it's the things I'm really working on. I'll talk more about this in upcoming meetings. This week, boy, it's been a really tough week with the Silicon Valley Bank things. And congratulations to the mayor for his efforts in asking for help and better ways to work. And so just a good luck to ourselves, how we can do well in this upcoming year and to really continue a road towards a positive openness. Thank you.
Back to the committee.
All right. See no more comments. Meeting's adjourned. Have a wonderful day.